World Infertility Month. The World Health Organization says 1 in 6 adults are affected by infertility worldwide, and the cost of treatment can be expensive. The WHO also found that people in poorer countries spend more of their income on treatment than those in wealthier countries. Joining us now for more on this is Dr. Afrouz Demeri. She's a fertility expert who helped formulate a WeNatal, a prenatal vitamin supplement that is for both women and for men. Thanks for joining us, doctor.
Thank you.
So what are some of the reasons behind this becoming such a common issue? It felt, Emery and I were talking, we've talked about this quite a bit, and we have no data other than empirical data to suggest that it seems as if now in 2023 or in the last 10 years or so, we've seen a rise in infertility among couples all over the world that we perhaps did not see, let's say, 20, 30, or 40 years ago.
It seemed like it anyway.
It seems like it.
Exactly. In 1940, we had 113 million sperm counts. It went down to 66 and 69, and now the normal is 15 million. And so I don't know where my son and his son are headed, but it's dropped 62% since 1973, and men now have 50% the sperm count that their grandfathers had. So it's an epidemic. It is really, really a problem. And it doesn't become a problem until people start wanting to conceive and they realize that, oh, what do we do? And they seek treatment, but there's a lot they can do beforehand to prevent and really improve quality, because the quality now is the shape of the sperm, what we call morphology. If you go and get a semen analysis done, and most people come to me and they're like, it's not the man, it's me. And I say, let me look at this report card. Most men have a C-, which means they are in the the bottom 5th percentile. That's what we consider normal now. So when I graduated medical school, what was normal then is it just keeps getting worse. And so now it's 4%. 4% of your sperm has to look normal for us to consider give you that C-, but we can move it up to a B or A, hopefully, with things that you asked about. What is it? What's causing this?
Do we know why this is becoming the new normal?
We need so much more research. Unfortunately, this is a field where we have a lot of anecdotal data, we have retrospective data, but we know genetics and age play a role, but we are not focusing on the significant culprits, which are environmental toxicants and lifestyle factors.
Well, let's focus on the lifestyle factors. And, what sort of lifestyle choices can someone make to improve their fertility?
First are the no-brainers. I say smoking nicotine, but also smoking marijuana. Marijuana is one that we were not sure about. And even when I graduated, it's something people didn't talk about. Now we're finding that they're more open about this with their doctors, and we're seeing research that it actually negatively affects the pituitary gland, which controls your hormones. And so it actually doesn't allow that sperm to enter into the egg. Other things are weight management, abdominal obesity, losing weight and making sure your blood sugar is controlled. Stress. Stress is a huge one because cortisol affects all hormones. It affects everything. And men are more stressed than they used to be in the 40s and the 60s. But I would say the number one thing that men can do today is change their diet and eat a healthier diet by first going organic. Lancet study showed that men who ate organic versus men who didn't had a 43% more sperm count than the ones who didn't. And nutritional factors such as antioxidants, L-carnitine, vitamin C, vitamin E, NAC, all of these have also shown that men who took these, which is all in prenatal, WeNatal, have their partner conceive 4 times more likely than men who didn't, and had a 5 times more higher chance of a live birth.
So let's talk about some of the concerns that women are having when it comes to infertility. We talked about the challenges for men. What are you seeing with women?
Women, a lot of them honestly blame themselves. And I do think that women need to know that 40 to 50% of the cause of their miscarriage or their infertility is on the men. So I do want to say that because I was one of those women that had a miscarriage, and no one ever asked about my husband's health, what he was doing. We never even saw, there isn't even a person to see unless you have unexplained infertility. Then men go to the urologist and they seek help. But women, are having children later, and so are men. And so the quality of the eggs are going down. And so, I have most women now over 30, sometimes over 35, even over 40 coming to my practice now wanting to have their first child. So age is a factor. And we're seeing a lot more hormonal dysregulation, such as PCOS. They're not even sure if they're ovulating. They were on the pill for a very long time, and now they're off the pill, and they think that, they're just going to get pregnant like that, and it doesn't happen the way they thought. So there's a lot of factors with women, but I really want to make sure that the women also know that they need to start paying attention, and it's 50-50, and that men need to be involved more in these conversations.
That's a really good lesson to leave people with. I think there's a tendency to focus on women, and particularly when you say, if a woman comes in and she's a little bit older, then it's a really easy pivot to just focus on her.
As opposed to the men.
Right, yeah. Right. And don't ask about the men until much further down the road, and then you've wasted a lot of time, Dr. Demeri, thank you very much.
Thank you.